Hello, I'm Barbara Coleman. I'm an IBCLC, and I'm here to talk to you today about how milk is made. So, how does making milk work? How are you going to know what to do? Well, good thing that we're often taken care of for us. So, there are a lot of moms that have concerns about making milk, not just making milk, but making the right amount of milk, not too much, not too little, lots of concerns. You may have already had concerns even during a pregnancy. So, let's get on with it. Myths and facts about making milk. Now, I've made quite an extensive list, and I may have thought of the things that you have thought of, but I may have thought of some other things too that are out there that you might run into. So first, we're just going to kind of get them out there, and then we're going to kind of talk about really what the reality is on making milk. You might be concerned that you're leaking a lot of milk or that you haven't leaked any milk at all. You may have had a breast reduction or a breast augmentation, or perhaps you've had a gastric bypass and you're wondering how that might affect your milk supply. You might have small breasts. You might have large breasts, and you're wondering how that might affect you making milk. You may be underweight. You may be overweight. You may have nipples that are flat, or you may have nipples that poke way out. You may have had trouble getting pregnant and maybe needed to use hormones and different medications to help you get pregnant. You may have diabetes and are wondering, how does that affect my ability to make milk? You may be taking antidepressants and wondering, can I continue to take those and still make milk? Will that be safe for my baby? Maybe you've been told that no one in your family has been able to breastfeed, so we know you aren't going to be able to breastfeed either. Hard to get through those messages that are given to us. It may be your second baby or your third or your fourth, and you didn't breastfeed before. And you wonder, will my breast know how to make milk this time? Maybe you have one side that makes a whole bunch more than the other side. Will that even work? Maybe you end up giving formula in the hospital and you're wondering, does that eliminate my ability to be able to make milk or the baby to be able to latch on and feed? Maybe you're wanting to have your partner feed your baby in the middle of the night so you can sleep. Well, how does that affect your milk supply? There are a lot of questions. We're going to talk about some of them that have to do with actually making that milk early on in this session. But the one thing I want you to know is that in all of those cases I've gone on and talked about, all of those situations, you can breastfeed. Sometimes it makes it harder, and kind of knowing that you might have an uphill ride on things actually helps to prepare you better for the event. So let's get on with it. So what does it look like inside a breast? How is milk made? Well, if we think along that pink line as to being the breast. And of course, we have the nipple and we have the areola. And the areola is that dark area that is around the breast tissue itself. And of course, the baby latches onto the nipple and the areola to be able to actually massage the breast. And then that fires up those little alveoli, that's up at the top there, to start making milk, and then to push that milk down the duct system, the milk ducts, and then to the nipple area so that the baby can drink it out. So it's not as if it's being shot out from the breast, but it's actually being brought down there to where then the baby drinks it out. And that's all that it takes for making milk happen, but so much more. So when we look and we think about hormones and hormones that support an adequate production of milk, we kind of run into several hormones, and it's kind of this balance between all these hormones that tend to make for a normal milk supply. One, you'll have a drop in progesterone. That's the hormone that's been plugging away from your placenta, keeping your milk from coming in prior to the birth of the baby. And it is the delivery of the placenta that all of a sudden we have a drop off in the hormone of progesterone, and that was what actually starts that milk production. We have insulin. And so if you have insulin resistance, and maybe because you have PCOS, polyovarian cystic syndrome, that may be influencing how well you utilize insulin and the sugar that you have in your blood. And we find for those moms, sometimes it's harder to make milk. And then your thyroid hormones. If you're low on thyroid, very hard to make adequate amounts of milk. So it's really important that you're speaking with your doctor, you're talking to nurses that are there with you during the birth about things that maybe are different about you so that you can get the right kind of information to be able to make that right amount of milk. And then talking with an IBCLC is going to be vastly important for you to be able to succeed beyond your wildest dreams to make plenty of milk for your baby. There are a couple of hormones that really kind of run the show when we talk about making milk. And one is called prolactin, and it's made in your brain, and it is made at the time that the baby suckles at the breast because it stimulates that production of the hormone that then tells those little alveoli, the little grapes, to actually start making milk. And then when it kind of floods your body, it tends to make you feel very sleepy. And especially during the early weeks of breastfeeding, you may notice that even more. And it kind of means, hey, your prolactin level is doing what it's supposed to be doing. So you can expect you'll go on, you'll feed, you get kind of sleepy as the feeding progresses. When you finish feeding the baby, it's a little bit easier then to wake up unless you're really sleep deprived. So it's all going to happen for you. And sometimes when we're helping a mom to build a milk supply, we will do things and suggest things that may make her prolactin level be higher, which helps to support her making of milk, especially in the early weeks. The second hormone that really comes into play is oxytocin. So if any of you have heard about induction of labor or augmentation of labor, it's that same hormone. When they put it in a drip bottle and it goes into your veins, well, that's the synthetic portion of oxytocin. Oxytocin that's made in your own body is what is normally stimulated by the baby suckling at the breast, different hormone pathway, but again, going up to your brain because that's what makes our hormones for this. And it actually squeezes on those grape-like structures when the oxytocin comes throughout our body, and it forces the milk down the milk ducts so that the baby can then drink it out. A lot of people call this also the milk ejection reflex, also called a letdown. So it goes by several different names. Some moms feel it as a tingling sensation, especially when you have a full milk supply and it's pushing a lot of milk down. Some people all of a sudden feel like it's getting really warm, and there are a lot of new moms that will feel it as some uterine cramping. So this oxytocin that kind of works to make your uterus tight so you don't bleed too much is also working on your breasts to make those little alveoli squish together to push that milk on out and down to your baby. And then that's how the baby gets fed. So that first milk we refer to as colostrum. So it's actually been made in your breast from about the 4th month of pregnancy on. And again, it's not changing qualities to become the mature milk because you have a placenta inside. It may leak, may not leak, doesn't mean any difference as to the amount of milk that you will make. And you may notice that it's different colors. Some is looking very yellow, some looks very clear, and sometimes it can look white. And all of those are colostrum. But you'll notice it doesn't come in a lot of quantity, and it's not supposed to. It's supposed to come to the baby very slowly, so the baby gets lots of practice with their mouth, a lot of sucking, which helps to build these muscles in the baby's cheeks, just what they're supposed to do. So when your milk does come in, the baby can be more effective at milk removal because they've had some growth of this muscle there in their cheeks. It's very high in protein when you compare it to mature milk. Very easy actually for the baby to digest and bring down into their system. So they get a little bit of nutrition from that, but again, it's very small amounts. They need it very, very frequently during those early days. Mature milk. The milk cometh. So it changes and increases in the quantity, usually sometimes between 48 and 72 hours. Occasionally might come in earlier than that, and then sometimes it may take longer. And sometimes some of those diagnoses that I talked to about the myths and realities and facts about making milk sometimes will inhibit the milk from coming in as early as some babies would like it to come in. So again, you want to be talking with someone to say, do I have any factors that might make it a little bit longer for my milk to come in? That first day, it's a very small amount, maybe about a teaspoonful, and that would be about 5 milliliters every feed. And that's coming from both sides. So baby getting onto both sides, and they're going to get about a teaspoon of milk of that colostrum. And then when the milk production increases and you say, oh, my milk has come in, usually they're getting about an ounce. And so maybe a ½ ounce from each side if it's making it evenly. So maybe the part I've put there is between 22 and 27 mils of feeding. And usually we consider about 30 mils being about an ounce amount. Fully mature milk usually happening at about 7 to 10 days after birth. We don't see any more of the colostrum being made, and it tends to be fully mature, which has a very low protein amount, very low in protein and very high in carbohydrates, because that's what we use to grow brains with. We don't need a lot of muscles like cows need, and that's what is in cow's milk, is very high in protein. We need low protein, but we need lots of carbs because we're going to use that for growing brain. And then at that point, you're usually beginning to make 1.5 ounces to 2 ounces at a feed. So you might be able to get about 1 ounce from each breast at that point. Medications. Well, medications can go through the breast. It's always very important when one is considering medications, especially after the baby is born, that you're looking at the risk versus benefits. Do they kind of balance themselves out, or is it too risky to do it, or do we have lots of benefits that even though there's a little bit of risk, we're going to need to do some medication, and maybe even looking at what alternatives might be out there. So we always want to balance that out. So there are some apps that you can put on your phone. I highly recommend doing this so that you know when a medication is being ordered for you, what those risks are and what the benefits might be. And will that affect your milk supply? And could that affect your baby and being in your milk? So one of my favorite ones is called LactMed, and that is a free app. You see a picture of that opening page there, and it's from the National Library of Medicine. And you can download that on there and do a drug search, a name, and it'll actually tell you about the research that's been done on the medication and what effects that it might have on your baby and on your milk supply. There's also an app called Mommy Meds from the Infant Risk Center, and it costs something. I don't know if it's like $2.99. It's not a high cost. The nice thing about that is very helpful for over-the-counter drugs. So it actually has a scanner in there that you can scan the drug, and then it will tell you what it knows about that medication. You can actually also call the Infant Risk Center, which exists in Texas, over on the west side of Texas, and they can always answer your questions too. So let's talk a moment about pain meds. There are a lot of moms that go home, they're hurting after birth. Maybe their bottom is sore, maybe they had stitches, maybe they had a cesarean, and you're given a pain med prescription to be able to deal with your pain. And that's why I talk about alternatives. So if your bottom is sore, are you using the little squeeze bottle to clean you off with? Are you using sitz baths to be able to do a little soak on your bottom in a clean way so it doesn't risk infection? Are you using ice on your bottom? There are lots of different techniques that can give you pain relief besides just pain medication. So it's always good to consider what those alternatives might be. There are some pain medicines that when they go into your system and you metabolize them, that can create problems, can get into your milk supply and make your baby sleepy. So anytime you're taking a medication, you always want to be aware of how your baby is reacting. And if there is a change, you want to bring that up to your pediatrician so that you can say, maybe this is a problem for my baby, and be able to come off of that medication. So what supports milk making? How do you help it to do its thing? Well, certainly a low intervention labor and birth and low amounts of medication is really going to help that process out. We know that high interventions, lots of things going on, can sometimes inhibit that milk from coming in. We know that that full delivery of the placenta is very important because, again, that you're getting that drop off on your progesterone, which is going to help your milk production begin. Skin to skin holding, so important that you get that chance to cuddle up with your baby. Your baby's touch, the suckling of the breast, actually the baby touching the breast, and the removal of the colostrum is a big help in starting that milk to be produced. So those are the things you want to be thinking about in the early day or so after giving birth. Mom's nutrition, very important. So you want to look to say, what is it that I'm putting in my body to heal my body from the birthing process and to start that milk production for me. Certainly there are lots of people that are undernourished in the world and still are able to breastfeed their baby. But if you want a good supply, you want to do the things that you have control on, you want to make sure that you are making a well-balanced diet. Because the more you do that in the early months after giving birth, that's going to help you when this baby is then now your child and sitting at your dining room table, that you're going to be able to want to introduce them to a full range of foods. Adequate fluids are very important. You get dehydrated, it's really a lot harder to make milk. So you want to make sure that you're not thirsty all the time, but occasionally thirst will tell you, hey, you need to go get some more fluid on board. And then you can always look at your pee. The clearer that pee looks, not looking concentrated, is a good sign that you're being adequately hydrated. But the thing I want you to remember, it is the early, frequent, effective removal of milk from your breast that helps to make more milk as time goes on. So that's what I want you to remember. So to know that what you need to know. Sometimes you have things that you have control over, and that might be the doctor that you use, or the place that you give birth. You may have control over movement and labor that helps to decrease the amount of interventions that you have in labor. Having your baby, asking for your baby right away so that you can hold your baby skin to skin. And then there are some things you have no control over. You don't know if you're going to have the 2-hour labor or if you're going to have the 36-hour labor. So you kind of have to be able to roll with the punches if this is something that you cannot control. Perhaps you have gestational diabetes. At that point, you can't control that, but you can do the things that you're being asked to, that you have the control over, to change your diet, to ensure that you can keep your blood sugars at normal level. That's going to help you to grow the right size baby and to be able to pass that baby during an effective labor and delivery. So do what you can do, and then reach out for help early. Don't wait too long before you're saying, I don't know if this baby is doing what it should be doing. So make sure that you've got an IBCLC's name, number that you can reach out to if you're in the hospital setting, that you're able to have that person come in and have that full conversation with them about how things are going. And then you remember this phrase, it's the early, frequent, effective removal of milk from the breast that drives the production of the milk over time. Okay, now we know how milk is made.